What is toxicodynamics? Toxicodynamics describes what the toxicant does to the body. In other words, the interaction between the toxicant and biological targets, such as cells, tissues, and organs, leading to toxic effects. For example, organophosphate pesticides inhibit acetylcholinesterase, an enzyme critical for breaking down acetylcholine in nerve synapses. This results in excessive nerve stimulation, causing tremors, salivation, and respiratory distress. Understanding toxicodynamics helps veterinarians predict symptoms and tailor antidote strategies to counteract the toxicant's mechanism of action. What is toxicokinetics? Toxicokinetics focuses on what the body does to the toxicant, tracking its absorption, distribution, metabolism, and excretion. For example, after ingestion of lead-contaminated oil, lead is absorbed into the bloodstream, distributed to soft tissues and bones, and excreted slowly through urine and bile. Toxicokinetic studies help establish withdrawal periods for food-producing animals to ensure residues fall below safe levels, protecting human health. How does metabolism affect toxicity? Metabolism transforms toxicants into more water-soluble compounds for easier excretion, typically reducing toxicity, a process called detoxification. However, some toxicants undergo bioactivation, where metabolism produces more harmful metabolites. For example, paracetamol in cats leads to the formation of toxic intermediates that their limited glucuronil transferase cannot neutralize, resulting in oxidative damage to red blood cells. Understanding metabolic pathways is crucial in predicting species-specific vulnerabilities and providing timely treatment. What is biotransformation in toxicology? Biotransformation refers to the chemical modification of toxicants by the body, primarily in the liver. This process involves two phases. Phase I, functionalization. Introducing or exposing functional groups through oxidation, reduction, or hydrolysis. Phase II, conjugation. Attaching large, water-soluble molecules like glucuronic acid or sulfate to enhance excretion. For example, benzene is metabolized in the liver into active intermediates that can damage bone marrow, leading to aplastic anemia. Biotransformation determines both detoxification and potential bioactivation outcomes. Why are some species more sensitive to certain toxicants? Species sensitivity arises from differences in anatomy, physiology, metabolism, and genetics. For instance, cats lack sufficient glucuronil transferase enzymes, making them especially vulnerable to drugs like paracetamol. Fish, with their permeable gills, rapidly absorb waterborne toxins. Birds, due to high metabolic rates and thin lung barriers, can be severely affected by inhaled aerosols. Recognizing these interspecies variations is essential for dose adjustment and risk assessment in veterinary practice. What is bioaccumulation? Bioaccumulation refers to the gradual build-up of toxic substances in an organism's tissues over time, often surpassing environmental concentrations. Classic examples include mercury in fish and dioxins in animal fat. These substances are typically lipophilic, fat-soluble, and resist metabolism, leading to higher concentrations as they move up the food chain. This poses significant risks to both animals and humans consuming contaminated products, making bioaccumulation a critical concern in food safety and environmental health. What is biomagnification? Biomagnification describes the increasing concentration of toxicants at successive levels of the food chain. For instance, aquatic invertebrates absorb methylmercury from contaminated water, small fish eat these invertebrates, larger fish consume small fish, and top predators like tuna accumulate dangerously high mercury levels. This magnified exposure threatens wildlife and human consumers alike, emphasizing the need for environmental monitoring and regulatory limits. How is LD50 defined and used in toxicology? LD50, or lethal dose 50%, is the amount of a substance that kills 50% of a test population under controlled conditions. Expressed in mg/kg body weight, it provides a standardized measure of acute toxicity. For example, the LD50 of caffeine in dogs is about 140–150 mg/kg. While LD50 does not predict chronic or low-dose effects, it remains a vital tool for comparing toxicant potency and guiding safety classifications. What is NOAEL in toxicology? NOAEL stands for No Observed Adverse Effect Level, representing the highest dose at which no harmful effects are detected in test animals. For instance, if poultry feed contains aflatoxin levels below the established NOAEL, no liver damage or performance decline is expected. Regulatory agencies rely on NOAEL values to set safe exposure limits, incorporating additional safety factors to protect vulnerable populations. What are biomarkers in toxicology? Biomarkers are measurable indicators of exposure, effect, or susceptibility to toxicants. They help detect early changes before clinical signs appear. For example, blood lead levels serve as biomarkers for lead exposure. Elevated liver enzymes, ALT, AST, indicate hepatotoxicity. DNA adducts reveal exposure to carcinogens. Using biomarkers enhances diagnostic accuracy and supports monitoring programs in both veterinary and environmental toxicology.